Hello, Miss Zhao. Welcome to Ward 1A. I'm your case nurse, Miss Chen. We are going to do some physical examinations for you.
Oh, pardon me. I need to go home right now. I need to prepare dinners for my sons.
Aya!
What happened? Why did you get hurt?
Ah!
Miss Zhao impulsively sketched my arm. It's okay as there is no active bleeding. No need to report airs.
Don't worry about the airs. You should go to the treatment room and do some first aid first. Please tell other colleagues about the incident. We need to put Miss Chow back onto the bed as soon as possible. Okay, we are now going to restrain Miss Chow in view of her agitation and behavioral problem. During my explanation, may Lily please get the bed and curtain ready first. Remember to take the full arm protector as well. After that, Chen, please help to control her left arm and Kathleen will hold her right arm. YY and Rebecca will hold her left and right leg respectively. And I will be responsible for protecting her head. Please be reminded of her agitation and impulsivity again, or else you may get hurt. Is that clear?
Clear.
Yeah.
Miss Chow, we apologize for making you uncomfortable. However, in view of your fluctuating mental status, you should take a rest on the bed with the help of the restraints. Please be cooperative.
Why? Tell me why. I just want to cook for my sons.
Let's get started. Have all her limbs been secured on the bed? Did anyone get hurt? Chen, please continue to monitor her condition and finish the corresponding documentation. I shall counter-check your work afterwards. Thanks, everyone. We'll have a debriefing later. Thank you, Dr. Strange and Mr. Chow, for joining our meeting today. It's nice to meet you. We are discussing the management of future violence prevention, treatment goals, and discharge plans. Mr. Chow, sorry that Ms. Chow was agitated and one of our staff was injured by her. Therefore, we needed to restrain her in bed for a while.
I'm sorry about what my mom did. I hope the injured staff will get well soon. My mom felt insecure in the hospital. I understood the need for restraint. Thank you for helping my mom. May I know what's the current treatment for her?
The treatment can be divided into pharmacological and psychological perspectives. For the pharmacological part, we have reviewed her drug regime. Ms. Chow experienced episodes of hypotension and prolonged QTC, which can be a risk of irregular heartbeats. Maybe Dr. Strange, you can take a look at her current medication profile, especially her anti-hypertensive drug and memantine. In addition, you may consider consulting the physician for advice. For the discharge planning, maybe we can refer outpatient occupational therapists for home setting modification for assisting her ADL.
All right, I will take a look at the anti-hypertensive drugs. Oh, her QTC was 482. Please arrange an ECG and cardiac monitoring for her, and I will consult medical colleagues and occupational therapists. By the way, I plan to discharge Ms. Chow if her condition is stable within these 2 days.
Thank you, Dr. Strange. We will keep close monitoring on the patient to make sure she is physically and mentally stable. Mr. Chow, we will wait for the medical doctors and adjust her drug regime accordingly. In the psychological part, we are providing remnants therapy, which is a kind of cognitive stimulation training to make her mind clear. Also, we will try the door therapy, which may also help to calm her mood after discharge. Moreover, we are going to make use of some technological devices. Look, this is a trumpet. It can speak a lot to Ms. Chow. It has the unique ability to provide cognitive, social, and emotional support, and it is useful in maintaining cognitive function of patients with dementia. I've prepared the information sheet of door therapy and trumpet for your reference. For discharge planning, we have referred to occupational therapists for modification of Ms. Chow's home. It is hoped that the facilities will be helpful for dementia patients. Do you have other inquiries and suggestions?
Your suggestion sounds good. Hope it will help my mom. Thank you for all your efforts.
We all know our workplace violence event about Ms. Chow's case today. Unfortunately, Chen was injured. There are some learning points that I would like to highlight. As an MOV trainer, let's have a mini training to record the MOV skills. Chen, can you please demonstrate the breakaway technique on how to escape from a patient who is holding your hand? The correct form should be like this. For handling complicated and violent patients next time, we should call for help. Always remember that your safety is the top priority. Regarding the use of physical restraint, it is the last resort we could use to manage undesirable behavior of patients. Please apply restraint properly according to relevant guidelines and protocols. To analyze the cause of this violent incident, I have made a fishbone diagram with case nurse Chen for your reference. This is the preliminary version of the root cause analysis. We could make improvements from these. Moreover, I've invited Chen to initiate another nursing care plan on risk of violence to others in the next nursing meeting to arouse our attention in the future.
Well, I will implement the nursing care plan. All nursing and supporting staff, including TUNS, will be reminded of the risk and relevant nursing interventions. Meanwhile, a cornerback was assigned to Ms. Zhou to separate her from the other co-patient as suggested by APM.
So after this incident, how are you reviewing the case these days?
According to the department's guidelines, case doctors should review patients' condition after restraint every day. Dr. Strange has done his job well. Chen should initiate a multidisciplinary team approach with different healthcare professionals for the discharge planning. I will help you with that.
Are there any nursing interventions for the patient other than reviewed by case MO?
We now have some evidence-based innovative approaches to reduce the severity of BPSD, such as the door therapy and CHAPIT. It is difficult to implement the PEX therapy at this stage due to the COVID-19 pandemic. I would like to share some up-to-date journals about the effectiveness of door therapy and CHAPIT. You may feel free to have a look. I've also instructed Rebecca to design an information sheet about the therapies for the relatives.
Well done, my APN. I'm interested to know more about these as well.